Hello everyone. Welcome to our press conference. Today, we will discuss about amoebic dysentery, its causes, background, treatments, and cure. First, Ron Kiefer-Raya, a gastroenterologist or an expert in the digestive system, will discuss about the background of the disease.
Amoebic dysentery is an infection of the intestine caused by an amoeba called entamoeba histolica that, among other things, can cause severe diarrhea with blood. Amoeba are parasites that are found in the contaminated food or drink. They enter the body through the digestive system when the contaminated food or drink is swallowed. The amoeba are able to move through the digestive system and take up residence in the intestine and cause infection. To talk about how you get amoebic dysentery, here is Malcolm Chico, a doctor whose specialty is treating disease like this.
Okay, so how do you get amoebic dysentery? The Entamoeba histolytica, which causes amoebic dysentery, can exist in two forms, in contaminated food or drink. It can exist as free amoeba, known as trophocytes, as infective cysts, which are a group of amoebae surrounded by a protective wall that have been passed in the carrier's feces. If you swallow contaminated food that contains the free amoebae, hardly anything is likely to happen because they usually die in the stomach on account of its acidity. On the other hand, cysts are particularly resistant to the acidic contents of the stomach, and food contaminated with cysts represent a genuine risk of infection. When the cysts reach the intestine of another person, the individual amoebae are released from the cyst and are able to cause infection. Amoebic dysentery is passed on by careless or negligent hygiene where contaminated food and drink is consumed without adequate heat treatment. Now here's Mr. Darren Ugaban to tell the symptoms.
Okay, so amoebic dysentery may not demonstrate any symptoms for a long period of time, months or even years. But individuals that is infected by amoebic dysentery still excrete cysts and consequently infect their surroundings. When amoebae attacks, they damage the walls of the large intestine, causing ulceration and subsequent bleeding. The milder symptoms of this are frequent loose stools, abdominal pain, fatigue, intermittent constipation, stomach cramps, painful passage of stools, and bloody, slimy diarrhea that's often foul-smelling. But the course of the disease can become complicated and alter radically if the amoeba breaks into the intestinal wall and damage is lining or the peritoneum, which causes peritonitis or the inflammation of the peritoneum. In the long term, the amoeba can, among other things, form enormous cysts and in the liver and other organs, which sometimes may only be discovered through investigation of other conditions such as weight loss and other illness. Now, here is Jian Magtibay to discuss the possible preventions.
So first, let's talk about what can you do to prevent getting amoebic dysentery. In practice, the only way to avoid infection with amoebic cyst is to ensure that everything you eat or drink has been washed or sterilized properly and cooked thoroughly. Drinking water can be made safe in two ways. By boiling it 10 to 15 minutes and then cooling it rapidly and keeping it covered. By adding water, purifying tablets and then leaving the mixtures to stand for at least 15 minutes before use. By using a filtration device such as Aquaport Traveler or Sawyer filters. Chemical methods of sterilization do not, however, guarantee complete destruction of all possible harmful organisms. Foods to avoid include salads, unpeeled fruit, and ice cream. Ice cubes may also have been made with contaminated water, so avoid having drinks that contain ice cubes unless you're certain that the water used to make them has been sterilized. Now here's Dr. Andre Salamat to tell the treatments and diagnosis.
Let's discuss the possible diagnosis. Anyone who develops bloody diarrhea should see a doctor as soon as possible. In the presence of the classic symptoms of amoebic dysentery, the diagnosis can often be made by means of a stool analysis. Bloody diarrhea is seen in many other illnesses, but in tropical areas, the diagnosis will typically be either amoebic dysentery or shigellosis. Lastly, the possible treatment. Amoebic dysentery is treated with metronidazole or flagyl tablets or tinidazole or phasigene. A problem arises in that some of the parasites will not respond to treatment and the medicines required to totally get rid of the disease after the above treatment are not readily available. Complications such as perforation of the intestinal wall or the presence of abscesses within the body organs require specialist hospital treatment. In an emergency, for instance, if you have bloody diarrhea and are on holiday in the tropics and cannot get medical help, you can treat yourself with metronidazole 400 milligrams tablets 3 times a day. For adults who are neither pregnant nor breastfeeding. It's important to avoid drinking alcohol during treatment. Even if you have to treat yourself, it's important to see a doctor to ensure that the treatment has been truly effective. As metronidazole requires a prescription, you could ask your own doctor or travel clinic to write a private prescription in advance if you know that you will be traveling to remote tropical areas where access to a doctor or hospital may be difficult. Such as prescriptions need to be issued privately. The cost of the drug has to be paid in full to pharmacists. To sum up our press conference, here's Mr. Daryl Ugaban again.
So, today, we have talked about amoebic dysentery. Amoebic dysentery is an infection caused by amoeba called Entamoeba histolytica, which causes bloody diarrhea. A person can have amoebic dysentery by drinking or eating contaminated foods or drinks. Amoebic dysentery symptoms doesn't show up for a long period of time. It can only be discovered by investigation of other conditions such as weight loss. Preventions that can be done is proper hygiene and sanitation. Treatments are metronidazole or tinidazole. And when you encounter something wrong with your body, consult a doctor since it may be amoebic dysentery. That's all for today, guys. Hope you like our press conference. Goodbye.